So a little bit about PESCA-PICS. This is our educational webinar series that the Indigenous Cultural Safety team has put together. We're really excited for this series. It's been a lot of fun for our team to kind of produce and get started. So essentially what PESCA-PICS is an opportunity for those folks who are experts in Indigenous cultural safety to come together and to share their knowledge with Vancouver Coastal Health. So for today's session, we're going to be welcoming the Indigenous Patient Care Clinician team. We're so happy to have you. And then just as a quick introduction for myself, my name is Nisha. I'm the Indigenous Cultural Safety Coordinator here at Aboriginal Health. We're going to be having a little bit of a Q&A at the end of the session. So for folks that might have some burning questions, we just ask that you please put them into the chat box and we'll try to answer as many of them as possible at the end of the session. So I'm going to turn it over to the Indigenous Patient Care Clinician team, and we're so happy to have you guys.
Hi, everyone. It's great to be here. My name is Emily. I'm one of the Indigenous Patient Care Clinicians with Vancouver Coastal Health, and we're going to be talking about who we are and what we do. But before we do that, Nikki, if you could just go to the next slide. We just want to take a moment to really honor and acknowledge the intensive and exhausting work being done on the front lines during the pandemic. We understand that everyone is worried about their own health and safety and that of their loved ones, families, co-workers, friends, patients. And we recognize the emotional, physical, and mental toll that working through a pandemic takes on healthcare workers. The In Plain Sight report by Mary Ellen Turpel-Lafond really highlighted that current public health emergencies magnify racism and vulnerabilities and disproportionately impacts Indigenous people. It also revealed abundant evidence that significant Indigenous-specific racism is widespread and has been for some time. So we just want to thank everyone for taking the time in your busy schedules to learn about the work being done to address the report's findings and recommendations. And if you could go to the next slide, Nikki.
Great, thank you, Emily. Yeah, so my name is Jessica. I'm another of the Indigenous Patient Care Clinicians. And just to kind of give a bit of our context, the Indigenous Patient Care Clinicians, we're a new role and we sit within the Aboriginal Health Patient Experience team. And so that's also within the Aboriginal Health team here at Vancouver Coastal Health. So this new team is evolving and growing. The IPCC role is kind of joining alongside the really great work that's already been being done by the Aboriginal Patient Navigators team who've been in place and providing that kind of direct patient and family support and doing that on the ground cultural connection and cultural and spiritual care support. So we're joining that to kind of expand the capacity and type of support and interventions that we can provide. And we also work alongside so many other teams and components of Aboriginal Health, and that includes the Indigenous Cultural Safety team, the new Aboriginal Patient Care Quality Liaison roles, and just again the work is expanding and growing, and we're all working together to address the needs in healthcare. And so this is to acknowledge that the work of cultural safety, of providing good healthcare to Indigenous folks, has been happening for a long time. The work and the needs is not new. However, what we're able to do right now is we're able to draw on the momentum and impetus that comes from evidence like the In Plain Sight report and the growing awareness and commitment from healthcare leaders and providers to work towards, using terminology from the In Plain Sight report, working towards hardwiring Indigenous cultural safety into healthcare. You can move the slide.
Yeah. Hi, my name is Brandi. I'm another one of the IPCCs. So just introducing the role of Indigenous Patient Care Clinicians. We are here to combine our passion for nursing and our Indigenous heritage to honor the strength and resiliency of Indigenous people. These roles were developed to help improve the Indigenous patient experiences in a healthcare system that has historically produced direct negative impact on the health and well-being of those Indigenous peoples. So we are not entering into this role presuming to be the all-end experts on Indigenous worldviews, knowledge, and practices, but we do each have our own lived experiences as Indigenous people, and that is what we bring to this specific role. So we each respect, honor our own culture and tradition, as well as recognize the common threads and shared history with other Indigenous peoples, especially related to ideals around health and wellness. So this is going to be and is an ongoing learning process for us as well, but we are here to work towards getting it right. We will be learning alongside the healthcare teams in addressing the health disparities that Indigenous patients experience. And we want to be working collaboratively toward meeting the goals of Vancouver Coastal Health in providing culturally safe and responsive services throughout the organization. So us specifically as Indigenous patient care clinicians, some of the supports that we will be providing, so helping patients and families strengthen their understanding of, as well as be more confident in their healthcare plans and prescribed treatments. So because we come from a clinical background, we'll be able to support the patients and families in that. We're also going to be supporting the Indigenous patients to tell us about their experiences in the healthcare system, and that will enable us to further work on changes that can support those culturally safe practices. We can consult on inpatient care planning and on discharge planning to try and bridge the gaps between hospitals and the community continuum of care. We're also looking to identify opportunities for cultural safety training and support the application of ICS into practices. We also want to provide and be resources to the staff to enhance that healthcare delivery in a way that ensures we are providing safe, equitable, and respectful care to Indigenous patients. So we can go next slide, Nikki. Oh, let me see. Good. So the Indigenous patient care clinicians, so there's 3 of us. We will be located, I myself am located out of Lionsgate Hospital. Emily and Jessica will be home-based out of Vancouver General, but we are providing services to all of Vancouver Coastal Health sites and services. Good, and we can go next slide. Just gonna pull that. Sorry, good. Oh, sorry. So just to introduce each of us, my name is Brandi Dan, as I said. My mother is of settler English and Scottish descent, and my father is of First Nations and Chinese descent. My paternal grandmother is from the Secwepemc territory, which is interior BC, and she belonged to the Bonaparte First Nations in Cache Creek. So I have been working within the healthcare system in various roles as an RCA, an LPN, and an RN for over almost 13 years now. For the past 5 years as an RN, I have worked in long-term care, acute medicine, and I have also taught internationally educated nurses in their preparation for assessments and licensing in Canada. I am new to Vancouver Coastal Health. I just joined in April, supporting the COVID response initially, and I moved to Aboriginal Health and this new position in October. So these pictures I share with you are pictures of my late granny and my late auntie, as well as the next generation of matriarchs in my family, Paris and Georgia. So I share these photos because this is what really drives me in my career, and specifically in this position, to be better myself, to be part of the solution moving forward, and to support good changes in the healthcare field in general. Someone who I respect immensely and who gives me the confidence to fulfill this role reminded me about the Iroquois 7 generations philosophy recently, and that is the decisions and choices that are made or experiences lived continue to affect the next 7 generations to come. So when I reflect on that philosophy, I understand my role in receiving the wisdom from my previous generations in my family, translating that during my time into my chosen profession, which I'm so grateful to be in healthcare, in the hope of creating a better healthcare system for the generations coming after me. So I am very lucky to be a part of this amazing team, and I'm so humbled and grateful for this opportunity. Thank you. Next slide.
Gela Kasla, thank you, Brandi. So nugo Kwanhalogwa, nugo Muskwagdalgino. My name is Jessica, and my Kwakala name is Kwanhalogwa, which translates roughly to Thunder Woman. My family is from the Muskwagdalgino Nations on my father's side, and so we're from the Broughton, what is now the Broughton Archipelago, is our territory, and I'm settler British and Irish on my mom's side. I have shared here a photo of me on my territory, and this was taken in 2013 when I, along with my sister and some of my my auntie and my cousin, we decided to undertake a hike up our river, up our valley, to become more connected and aware of our territory, and kind of like retrace some of the steps of our ancestors. It wound up being a comedy of errors, but it was one of the starting points of my journey to nursing. So before this time, I was working in television and news production, and was really struggling to feel kind of what my purpose was and how I could be of service to my community. And when I was in Kingcome that summer, I was really moved by the role of nursing in our community, and what nurses brought to the relationships and the healthcare journeys for folks. And so so I went to nursing school, and I've been a registered nurse for 3.5 years. I've worked, my clinical background before joining this role has been working in with youth with mental health and substance use issues at the Carlisle Center in Lionsgate Hospital. I've also taken on a role, a couple of different roles in teaching. I teach Indigenous Health to a registered psychiatric nurse program, and I've helped to teach Indigenous Health to UBC nursing students as well. I'm currently completing my Master of Science in Nursing at the University of British Columbia with a focus on cultural safety and mental health services for youth. And so I've been really called to the work of looking at and understanding the need for cultural safety and care, in healthcare, and looking at ways that we can, as practitioners, as healthcare systems, make the changes necessary to create these spaces of safety, because we know that that has not been the case in our systems up to this point. And so, so it's been a bit of a journey to get here, but I'm now in this role of Indigenous Patient Care Clinician. I joined the team in December, so still really learning the ropes, and learning what our what our identity is within the system. But the lens that I can bring to this, while you know, not reflective of every Indigenous person or every Indigenous nurse, is you know, my experience and my expertise as kind of a mixed race Indigenous woman who has lived experience and has supported family through the healthcare system, and who has seen some really great practice in cultural safety and some areas for opportunities for improvement. And so I'm really looking forward to trying to take all this like theory that I have and that people have from different training and experience, and putting that into practice. So it's an honor to be in this role and to be walking this journey with everybody. Next slide.
Thanks, Jessica. I'm Emily. I'm Métis on my mother's side with ties to the Morton family from Duck Lake, Saskatchewan, and settler Scottish and English on my father's side. I'm a daughter, a sister, a cousin, a niece, a partner, and an auntie to 8 beautiful nieces and nephews. I grew up in the Similkameen Valley in the South Okanagan, but I started my nursing career working in Pearl River General Hospital on the medical, surgical, and obstetric units there. I spent a few years in Pearl River before moving to Vancouver to work in the intensive care unit at Vancouver General Hospital. And as I started to learn more about Indigenous cultural safety in healthcare and the history of Indigenous people in what is now known as Canada, I started to recognize feelings of distress when I had to physically restrain patients who identified as Indigenous. So most intubated patients in the ICU are restrained because that airway is what's keeping them alive. And the patient's first instinct is to pull it out. Medically, I knew why it had to be done, but mentally and emotionally, I really started to struggle with it because of the legacy of residential schools and Indian hospitals. And there was actually one time that a patient of mine who was Indigenous self-extubated because I even physically struggled to restrain them. So I knew I had to lean into that feeling, and it really made me start to think about how to incorporate Indigenous cultural safety into practice. And this is what really guided me into the role of an Indigenous patient care clinician. So I share these photos of my Métis great-grandfather alongside a picture of my grandmother, my mother, and me, just as an example of the effects of colonialism. My great-grandfather was a trapper and spoke Cree, French, and English. And although a lot of knowledge, language, and traditions have been lost in the 3 generations that follow him, what really stands out to me are the memories from my Métis family gatherings that are full of laughter, joy, and music. And that is what I hope, as Brandi said, to kind of pass along to the generations to follow me. So the cumulative experience of my family resulted in me not being aware that I was Métis until I was in grade 7 or so, when I was registered with Métis Nation BC. And even though I was recognized as a citizen of MNBC, I didn't really know what it meant to be Métis, let alone the historical context of what it meant to belong to one of 3 Aboriginal groups under the Constitution. It was really something that wasn't talked about too much in my family, and I didn't grow up surrounded by Métis culture, which is a common experience of Métis people. And it really wasn't until I started nursing and learning about Indigenous cultural safety that I actually started to feel a little more safe to kind of own my own Métis identity. And I recognize that my experience is a veiled one compared to the discrimination that people in my great-grandfathers, grandmothers, mothers, and my own generation have experienced. I recognize that I experience and continue to experience certain privileges that my settler identity has unfairly given me, because people look at me and don't think I'm Indigenous. I'm a bit culturally ambiguous. So recognizing all of that, I see this role as an Indigenous patient care clinician as a way for me to continue my own journey of unsettling myself, decolonizing myself, and really reclaiming my Indigenous identity. It's also a way to help improve Indigenous patients' experience throughout their own healthcare journeys, and help healthcare workers incorporate Indigenous cultural safety into practice. So as Brandi had mentioned, we are based out of Vancouver General Hospital in Lionsgate, but we do provide support to all of Vancouver Coastal Health's acute care sites, and including yeah, within Vancouver and the lower mainland and to the coastal and central coast sites as well, as well as along the Sea to Sky. Right now we have support available Monday to Friday, 8:30 to 4:30, but in the future we'll be extending our coverage to evenings and weekends as well.
And so the big question often is, when do you get in touch with us? And so our team is here to provide support at any point during an Indigenous patient or family's journey in the healthcare system. The earlier we can be involved, the better. We can provide some proactive support to the team and to patients and kind of identify opportunities for culturally safe practice early on. So on admission of a patient who self-identifies an Indigenous or at any point, patients and families can also self-refer to our team at any point. Just want to highlight that it does not need to be a crisis situation or there have to have been some very negative experience for our team to get involved. And hopefully by like building these relationships between us and the other clinical teams, we can all strengthen our approach to providing culturally safe care. And also another part of the support that we provide, so a team can refer or request additional education or support in general. It doesn't have to be related to a particular patient's journey. And in kind of different ways we can support the application of Indigenous cultural safety theory and practice, and again, I identify opportunities. And referrals come in to the Aboriginal Health patient experience team, so the Aboriginal Patient Navigators and the IPCCs receive the referrals at the same time, and so we work together to identify and connect with patients and team to see how we can best provide support. So you don't have to decide whether you want the APN or the IPCC teams. You can send it in the referral, and we all kind of work together on our end to figure out how we can best support. And so that leads me into the next slide, which is how to submit a referral to our team. So there's several different ways. We're trying to be accessible. So if you're on the North Shore in Squamish, the best way to do so is to consult via Cerner. So any member of the healthcare team can submit a referral in Cerner. So that includes physicians, nurses, allied health. You can do that by entering an order for a Aboriginal or Indigenous consult, and that will be funneled through to our team. You can navigate yourself to the VCH intranet and search Aboriginal or ICS, and you'll find our contact information is pinned on the intranet. You can fax a referral form. We have a brand new referral form, which is located on the intranet. You can fax it to this number, 604-675-2552. You can email it to us, the info.aboriginalhealth, or you can call our intake line, which is also listed on the screen. And patients and families can also call and self-refer through the intake line as well. So a few different ways to get a hold of us. All of this information is available on the intranet, and that's where you would find the referral form as well. And I think we have a bit of a visual cue on our next slide for what that looks like. So yeah, so if you were to navigate on the my.vch.ca, these are the different ways you could find us. And then there's lots of education and kind of background information as well from the Indigenous Cultural Safety team that are also available on the intranet. So that's a great place to start if you have if you're finding yourself kind of maybe early on in your Indigenous cultural safety learning journey, or you need to touch base with some refreshers, or want to start some conversations with your teams, this would be a good place to start. And then we're here as resources as well.
So I think that that's it for our slideshow. Maybe we can move into the questions.
Thank you so much. That was a really thorough and wonderful presentation. The chat box is full of really interesting questions. You guys have generated a lot of buzz. I just want to raise my hands up to your team. I know you're new and you're doing some really great and important work. And so we're just so honored, the ICS team, to have your work showcased in this space today. So I'm going to read some questions off from the chat box. Jessica, Brandi, Emily, I'll just let you guys kind of decide who might be best suited to answer. So one of the first questions we got was, how does your team differ from the Indigenous Patient Navigators? So that was actually our very first Pesca Pick series. So folks who are watching this are interested in it. It's actually a film session that you can find on the VCH intranet site. So look that up as well. But yeah, so what's the difference between that team and your team?
Maybe sorry,
you
go ahead,
Emily.
Classic. Yeah, I'll touch on that a little bit, and feel free to jump in if you guys have more to add on. But we do work really closely with the Aboriginal Patient Navigators. So we have kind of joined forces to create the Aboriginal Health Patient Experience team. So under that team, we have the Aboriginal Patient Navigators who come from more of a social work background, and then we have our the Indigenous Patient Care Clinicians who are registered nurses. So we work really closely, and we kind of triage referrals to the most appropriate team members as they come in. So there is a bit of overlap. We do provide a lot of the same services, but we're really working now together as a team with the Aboriginal Patient Navigators.
Yeah, I really like that you highlighted that connection to the other team. I know that Aboriginal Health as a whole, we all work really closely together. So thanks for that clarification. Jessica, Brandi, did you want to add, or shall we move on?
I just wanted to remind the folks that when you submit a referral to our team, you're submitting to the APNs and the IPCC positions. So you don't have to decide which box to check off. You can submit it to us, and then we'll work together and touch base with the patient and family as well to figure out how we can use our kind of combined knowledge and skills and strengths to provide that support. So by submitting a referral, you're submitting to the whole kind of Aboriginal Health Patient Experience team, and we'll take some of that guesswork out of it for you.
Good to know. Building on that, another question that came about referrals is, when should people be making referrals? Kind of like what examples or scenarios would take place when it would be ideal to reach out to your team, yeah, for the work that you do.
So I'll just touch base on that. So just to echo what Jessica said in the presentation, we would really like early referrals for the patients that have self-identified, even if there isn't anything specifically that they're concerned about. But if we do get a referral, we can step in and offer the supports just so that they know that we're here. Yeah, so I think early, if there is a specific incident that you feel like they need our support, obviously refer at that time too.
Yeah, there's never really a time that's too soon, right, to reach out. Mm-hmm. That's good to hear. Yeah, so important.
We've been brought on at kind of as soon as, like in different instances, kind of as soon as someone's arrived on a acute unit, when their team kind of identified that they might have some difficulty based on their own kind of knowledge around making sure this person is connected to the proper community supports and services on discharge, and so they were kind of thinking towards that outcome early on, and so we were able to be involved and just be an extra additional part of the team to be attuned to different things that just might be different or unique for this person. Go ahead, Emily.
I have something to add too. It's not only inpatient sites, it's emerged too in ambulatory care. So we have had referrals come in from patients and an emergency social worker, because we can be there to just be with clients in the emergency department and act as kind of one more layer of support there as well.
Mm-hmm. Okay.
That's wonderful to hear. Yeah, you're already answering some other questions from the chat box, so it's great. You guys are really on a roll. I've also seen from the chat box that there's a lot of people that are really interested in your work and quite, what do I want to say here? Moved by the work that you do. And so there's been some interest in the chat box from folks about how does one become an IPCC? And what does that process look like? And do you have any tips for individuals who may be interested in working in a team like this in future?
What an interesting question. I think each of us came into these roles because the opportunity presented itself, and we've each of us have kind of gone through our own journey of kind of balancing our Indigenous identity with our roles in healthcare, and how do you kind of grapple with that tension of these don't always complement each other really well. And so I think I count myself as very fortunate that this opportunity came up when I was in a space where I was ready to really try to start to actualize the knowledge that I have and the kind of lens that I have on cultural safety. You know, maybe one day there is going to be a growing kind of need and demand for this role, and as it kind of changes and evolves. But I want to recognize that the people, the individuals that kind of fit in this role have to be able to bring that Indigenous lens and that kind of that clinical piece as well. So being able to tie those together in your kind of unique and individual ways, is what makes up this role so far.
And also being an ally too, it doesn't necessarily you know, have to be an Indigenous person, but yeah, it can be somebody who's an ally too. And I think for everybody, it's saying that if people are interested in this work, it's really important just to start your own journeys and your own learning processes, and really start to learn about the history of Indigenous people in Canada, and get involved in organizations and try to get your foot in the door however you can, if that's volunteering or however. I think when I first applied, I knew I wanted to work with Aboriginal Health. I think I first applied as an Aboriginal Patient Navigator for the posting, because I didn't know that this position was available, but I wanted to get my foot in the door somehow. So just kind of putting your name out there and getting involved however you can, and really starting that process for yourself of analyzing your own participation in all of this.
For sure.
I was just going to say too, Emily, like you're saying, start the journey, but also start incorporating that into your practice on the units that you're on. And like we have champions for MSIP, we have champions for hand washing, we have champions for PPE, and really like the hope is that we'll have ICS champions working on the units every day in rotation, and hopefully at some point in the future, then it wouldn't necessarily be a referral to the Aboriginal Health patient care or experience team. It would be, how can we start putting this into practice on the floor with everyone? So yeah, just another piece you can add to your experience and toolkit.
I love that. As someone who's part of the Indigenous cultural safety team, what I'm hearing from your team is that process of cultural humility, that constant self-reflection on the work that we do and how colonization affects the health outcomes for Indigenous people. And so it's really lovely to hear you guys articulate that. It's wonderful. Another question from the chat box comes, so what is your team's relationship to the Elder in Residence program? And can your team make referrals referrals to elders that Aboriginal Health works with?
So as the referral comes in, again, it's the entire team that is processing that and coming up with the care plan after we've touched base with the patient and the team on the unit. But yes, we have close relationships with our elders, and we will set up visits and services, or sorry, visits and cultural ceremonies from them. And one of our, sorry, go ahead, Jessica.
Sorry, Brandi. I just wanted to highlight that if when elders do become involved with someone's care in the way of visit or providing ceremony, that they're also part of the care team, and they're part of our team. And so we're working with clinical teams to ensure that that elders are welcome to the units. And in these COVID times of like being very conscientious of contact and people on the units, that elders are part of the team and that they're welcomed appropriately to the units. And we can also support if in-person visits not appropriate. We can support, and along with the APN team, support like Zoom meetings and Zoom visits and things like that as well. So,
and saying that too, that kind of plays along, Jessica, what you said with with Vancouver Coastal Health's Indigenous cultural safety policy. And one of the policy points is that patients have access to traditional medicines, and medicines, they don't have to be typically what we think of medicines. That can be drumming, singing, kind of ceremonies. So we're really here to advocate that patients have access to that, and the elders are part of that access and what enables that access for patients. So we're really here to advocate that the elders are part of the healthcare team and are not to be seen as visitors, but definitely a part of the healthcare team.
That makes me smile real big. Our elders are such good medicine, and to hear that your team is supporting bringing elders into spaces via, in person or potentially online is just so uplifting to hear. And I really appreciate your team, highlighting that, these elders are a part of the team. And so that's really warms my heart to hear that. Another question that came from the chat box is that some of the folks on our session today work with other health authorities throughout the province. And so they're wondering, are there counterparts? Are there similar roles to your position and other health authorities that you could help liaise with, etc.? Perhaps you could talk a little bit more about that.
Yeah, there are other roles, and every kind of health authority seems to have a different name for the similar roles. But that is, we have had referrals come in from Aboriginal patient liaisons and other health authorities, kind of just giving us a heads up that, hey, this patient is coming. Can you maybe touch base with them and see what kind of supports you can offer? We've had that from somebody in Northern Health and as well on the island too. So and yeah, so those resources are available to us too. We could kind of help navigate those.
Yeah, I know what you mean when you're saying that, different titles and different spaces, but it's really great to hear that, if we have the patients that are being transferred or getting services in different areas, that, that there is someone that our team can liaise with or connect folks with. So that's really powerful.
Yeah, and sorry, Nisha, I keep doing that. If you work in community and you have someone that is going to be presenting to Emerge or our emergency department, or they're going to be admitted to an inpatient unit, you can certainly get in touch with our team to give us a heads up and let us know that they're there as well, and we can again provide that kind of early support. And I think Emily spoke to earlier that we can go to meet people who are in the emergency department and support them from there, because it can be a challenging environment for folks to be in. And anyone, and let alone. So yeah, so that's a way that we can respond as well. And as we move towards having some extended hours, we'll be able to provide more of that kind of quick coverage.
Yeah, that's very exciting to hear that the hours will be extended. I know that your team is probably in high demand just because of the amazing work that you do. So that's really wonderful to hear. Another question that comes from our chat box is that there is currently a "do you identify as Indigenous" question within the case and contract tracing process. And so one of the questions kind of circulates around whether or not there's going to be training available for folks to answer this particular question or to pose this question.
So there is training, and it's actually, we did support a little bit in the development of that training, and some of us will be facilitating some of that training. So if you work in contact tracing and you haven't heard of it already, maybe you could connect with your pod supervisor and ask when that will be available to you. I know there are various sessions going on throughout this month. So maybe you could connect with your manager or supervisor and see if you could be involved in that training.
And for people who work within the acute care sites, it's also potentially a question that comes up about how to ask Indigenous self-ID questions. So we're also here to available to talk through different approaches with people to really make sure that those kind of questions are being asked in a safe way and respectful way.
Well, that's awesome to hear that there is some training coming down the way. And like you said, Emily, it is super important that we're acknowledging that, you know, safety needs to come with answering and asking this particular question. So that's good to hear. Another question that we have is there a form for the intake process to access your team? What does that particular form look like? And how do we access it? So I know that you guys showed that really lovely portion of your slide presentation, but maybe we could go into a little bit more detail about how we can access this particular form, or if it exists.
Jess, do you want to speak to that?
Yeah, I can speak to that. So yes, so there's a referral form. It's just a one-page form with just asking some basic demographic information about the specific patient for the referral, contact information for the unit, and that referral form can be found on the VCH intranet. And if you search in the search bar, if you just search Aboriginal or Indigenous cultural safety, it'll come up as one of the, I think the #1 or the #2 result on the search result. Also, I think someone just shared it in the link to it in the chat there. So you can complete that form and you can submit it return it to us by email or fax, and that information is available on the form itself. If you're just at a complete loss, we have a phone number as well, but that would be found on the intranet as well. If you are looking for kind of more general resources or education, you can use that same form, because on the bottom of that form, there's a box for reaching out for staff resource. So you can use the same mechanism to get in touch with our team and get that support as well. And we're trying to kind of funnel everything through that mechanism so that things don't get missed, so that our whole team sees what comes in and we can work together to make sure the proper supports are made available for folks. And I think that is that. And then yes, and then if you're in a Cerner site, to use you can use the consult process through Cerner. But if for some reason that's not working for you, you can use the paper form, but we really try to encourage people to use the Cerner functionality.
I think that's great. It's really wonderful to hear, you know, that this intake process can also be used for staff as well. If there are those questions of curiosity or that want or desire for further training, that you're there to support that as well. So it's really lovely to hear. Oh, Brandi, I see your hand up.
Nisha, because I think I saw a question in the chat about turnaround time, and that kind of is related to the referral. So generally we say about 48 hours, but based on, once we get in the referral, as long as it's regular hours for us, based on the acuity or the situation of the patient, then obviously we'll decide when and how quickly we need to get in contact with the referring agent or the client themselves.
That's good to know, and I really appreciate Jessica and Brandi, you guys also mentioning that, you know, your whole team has the opportunity to look over these intakes, and so it's nice to hear that it's that collaborative practice, and so that's lovely to hear. Another question that we have is, how will your team be sharing or advertising the work that you do within the larger Indigenous community? So are there plans to reach out to communities or to community agencies? Perhaps you could talk a little bit about that.
Yeah, I think that's a really great question. So far what's been happening, it's been kind of that one-on-one like relational basis. So sometimes when our team has been supporting like discharge planning or supporting someone in particular, we wind up talking to maybe the health teams in their community or the Aboriginal patient liaison in the health authority where they're coming from. And so it's been a bit more building those relationships kind of one-on-one. So there is a bit of an increasing awareness that we're here, but that's going to be an ongoing process. And if you happen to have a conversation with someone and they're like, hey, I wonder if there's this role that exists in Vancouver Coastal Health, you are also equipped with some knowledge now that we do exist, and you can point people in our direction as well. So yes, it's increasing, but we're getting the word out piece by piece.
Yeah, so important to hear, right? That aspect of letting community know that you guys are doing this really good work. For folks on the call, again, I just want to reiterate that this session will be recorded. So if there's members of your team that didn't have the opportunity to hear about these really amazing services, feel free to share the link with them so that they can be informed as well. So another question that we have from the chat box is, do you support clients who are followed by outpatient clinics in Vancouver Coastal Health?
I think if they are accessing our acute care sites, we will support them. And then we also have our other team members within the broader Aboriginal Health team that can also support patients in community too. I don't know if that kind of answers the question, but.
I think it does, yeah. Like we'll be able to be the ones to help direct those kind of questions, right? Mm-hmm. So anything that comes in through the referral, you know, an answer will be made. So that's really wonderful to hear. This question has come up in the chat box a few times, so I'm wondering if it's a real burning question for folks, is do we need the patient's informed consent in order to make a referral to this team?
Yeah, this has come up quite a few times actually since we've been on the ground and running in hospitals. It's a common question, and we've kind of talked about it in our team, and we're just another layer of support. So we're another service that is available within the healthcare team to provide supports to patients. So just as teams don't need patient consent to consult cardiology or psychiatry or spiritual care, it's the same with our team. So a referral can be made at any time, and that a patient self-identifies or anything like that, a referral can be sent in, and we can be the ones to go and talk to patients about the services that we provide. And this is especially important because not every person who identifies as Indigenous will want or need the support that we provide, and that's totally okay. But what we can do is support the healthcare teams. So even if we're not providing that direct support, we can support their healthcare teams to make sure that they receive culturally safe care, that Indigenous cultural safety is embedded into the practice, and that services that are required at the time of discharge will be available in their home communities.
And yeah, and to add, to build on that as well, it's when we talk about providing like culturally safe care, it's not just cultural practice or cultural support in those ways, because as Emily said, not everyone, that's not relevant to everybody or necessary. But part of our role as well is to just kind of give that other lens and way of looking and identifying opportunities for care and supports. And so it's really helpful if we're able to come in and have that conversation with the team and the patient as well, to kind of build out from whether someone needs cultural support as well.
Yeah, and in saying that, I mean, I recognize too that sometimes these conversations can be difficult with patients, or sometimes it can be uncomfortable when you don't know exactly what supports an Indigenous patient care clinician provides, or maybe what kind of cultural supports are available. So those conversations can be uncomfortable, which is totally fine and normal. And as everybody is on their own kind of process in the journey and own learning journey. So what we really want to make sure is that nobody's kind of missed, or nobody falls through the cracks just because maybe they don't have a full understanding of all of the supports that are available. So that's why we like to come in and really talk about what supports we can offer and what we can do for patients.
Thanks for that. I think that provides some clarity to folks in the chat box that have been asking this particular question. So we only have time for a few more questions. One of them is, do you work within the primary care network? Is that something that your team can do? Is that a possibility?
Currently, that's not our scope per se. However, if something was there, a need was there and it was brought to our team, we can see what supports there might be. And I mean, it's one of those things where if you don't ask or make it known that there's a need and an issue, then it's hard to kind of justify like filling that need, I guess. So our scope and kind of directive is for the acute care sites, with support to like the emergency department and that coordination across to community services. However, if you're in a situation where you're like, wow, I really wish I had this access, then maybe reach out, and maybe there's something that our team or our greater team can do, because as we're brand new. Our role is brand new, but we know that there's need all over the place. And while it might be outside of our scope in this moment, I think these conversations need to be had, and no one knows about them if they're not brought up. So hopefully I'm not overstepping.
No, not at all. I think you answered it really thoroughly. And like you said previously, part of that referral process, if there's a question, of course, you guys can be the connectors as well, right? And so it's really lovely and wonderful to hear. We are nearing the end of our session, so I just want to let folks know that if you have questions that we weren't able to answer in today's session, you could send them to icstraining@vch.ca. We can hopefully work with our Aboriginal Health team and provide you with some responses. Other than that, I just really want to thank the Indigenous Patient Care Clinician team, so Emily, Brandi, and Jessica, for joining our team today. It's been super informative to have you guys. As you can see from the chat box, There's a lot of eagerness to get to know your team and the wonderful work that you're doing. So just really raise my hands up in gratitude to your team. And thank you for being here. Were there any kind of closing remarks that you guys wanted to share?
Sure, I think we are. I think I can speak for all three of us just through dialogue that we've had individually. Like, we're really excited to be here and to work with all of the teams, and yeah, utilize us. Put those referrals in. I feel like a game show host now, but get those referrals in and just, yeah, incorporate us into your care plans for Indigenous patients. And we're just going to work collaboratively and together and yeah, try and make it better than what it is. That's what we're here for.
And yeah, likewise, thank you everyone for the passion and interest that you're bringing to this session and to your work. I know that the growing awareness that there is a need is there, and I know I speak for myself that I don't have all the answers or even very many answers to specific questions, but I want to be able to be present and open to working with whatever the need is and working together to figure it out. And that I know that we can do this work if we do it together and we do it open, and we're open and compassionate with each other as well. So I really look forward to this role and growing into it and having the role grow into the organization. And yeah, just thank you to everyone who's going to walk this journey with us.
I don't think I could have said it any better myself, so I just echo Brandi and Jessica. Thank you everyone for watching.
Well, big merci to your team. Thank you. For those of you who are still on the webinar, I just want to let you know that we have another Pesca Pick session next week at 10 a.m. It'll be with Aboriginal Health's Tammy Broomwell. You can sign up for that on our Eventbrite page. If you need the link, again, please feel free to email us at icstraining@vch.ca. Thank you. Have a lovely afternoon, guys.
Thank you.
Hi, Nisha. I just want to add, it's not next week, it's on the 26th. So it's the week after.
Oh, much appreciated.
Okay.
Details can be found on our Eventbrite page. So
of course,
take a look,
yeah.
folks.
I'll post
Thank
the link
you.
now. Okay.